I'm Dr. Scott Byer from Cameo Medical Center, and I've received many questions about different non-surgical body contouring devices. Cool Sculpting, Zerona, Smart Lipo, Venus Freeze, the list goes on. One of my YouTube subscribers asked me to share the differences between some of the more popular machines, so here we go. The first type of machine I'd like to talk about are the radiofrequency machines. Radiofrequency refers to the rate of oscillation. These devices work by generating heat. Just like the effect we see by cooking a piece of steak in a frying pan, we see it shrink in size. This is because of the collagen retraction. In a live person, we see this thermal energy causing skin tightening and contraction, also followed by new collagen formation by the stimulation of fibroblasts. Heat can destroy fat, as I demonstrate here with my electrocautery device, on fat that was removed after a tummy tuck. To generate this type of heat externally without damaging the skin does not seem reasonable to me. I do not believe these devices are effective at all for fat reduction. Although they may claim to be FDA approved, take a closer look at that FDA approval. Most of the time they are approved for heating deep tissue, not necessarily fat reduction. I personally do not believe this is a very good modality for fat reduction, but it is effective for skin tightening. Non-invasive lasers are also called low-level laser therapy. The definition of this technology means there is no heat generated by the laser. Additionally, there are no visible immediate changes noted to the tissue. Zerona, for example, works at 635 nanometers, and the science behind it is actually quite solid. It is FDA approved for the reduction of body circumference, and it does not harm the fat cell. The fat cell, after being exposed to the laser, has been shown to create a temporary window in the fat cell, and this allows the contents of the fat cell to escape, shrinking the cell in size. Where does the fat then go? It moves between the cells in the lymphatic system, and then it is finally eliminated from your body as waste. Patients are encouraged to drink ample water and take the recommended vitamins to maximize this elimination. With this technology, there is no heat, there is no pain, there is no downtime, there is no inflammation, there is no destruction or injuring of the fat cells. And when the patient is properly screened to see if they are a good candidate, the results are generally satisfactory. Cryolipolysis, or Cool Sculpting, uses the technology of controlled cooling to permanently destroy the fat cells. Zeltiq is the company that makes Cool Sculpting, and they, along with Zerona, are both FDA approved for long-term subcutaneous fat reduction. Generally, people require one treatment per area, and a suction cup is applied to the skin. The skin is protected to avoid getting a frostbite to the skin, and the fat cells are frozen to crystallization. This programs the fat cell to auto-destruct, and the results are usually seen between 1 and 3 months. Unlike many of the other non-surgical body contouring devices, this machine has very strong science behind it. It was developed by Harvard scientists. There are over 50 peer-reviewed journals showing its efficacy. And out of all the non-surgical body contouring devices on the market, I do believe this one is far superior to all the others. We do get excellent results in my office in New York. Ultrasound is another modality that by using mechanical motion within the fat tissues, it will produce cellular disruption of the tissue. Thermal tissue damage focuses effect on the fat cell like a magnifying glass concentrating light from the sun. This is also called HIFU, or a high-frequency ultrasound. The person's body then digests the fat cells over the next 2 to 4 weeks. The final result is seen in about 4 to 6 months. This machine is newer to the market, and as far as supporting research goes, it does not appear to be more effective than the others, but there is apparently a little bit more discomfort than the other modalities previously discussed. The concept for all liposuction is the same. Fill the area up with tumescent fluid or numbing fluid. Remove the fluid with the fat cells. This term is also called SAL, or suction-assisted liposuction, where a cannula is placed underneath the skin and manually stroked back and forth, removing the fat cells. PAL, or power-assisted liposuction, is where the machine actually mechanically moves for the doctor to ease basically labor for the doctor. It can also actually produce smoother results, and there has been studies showing there's less pain actually by using power-assisted liposuction. UAL, or ultrasound-assisted liposuction, also known as VASER, is when a wand is placed underneath the skin. through the fat tissue to emulsify the fat. Then that same cannula that we used before is actually put into the skin and the fat is sucked out. Water-assisted liposuction uses high-powered water injection to break up the fat. The cannula is then again placed in and the fat is again then removed out. And then there is laser-assisted lipo, which is all the hype right now. The most popular name is Smart Lipo. The reason this is a household name is one, they were first to market. Just like a photocopy is called Xerox, a photo used to be called Polaroid, acetaminophen is referred to as Tylenol, and a tissue is called Kleenex. Everyone remembers the first to market. Just like that first guy who went on the moon, no one knows the second guy. Second reason, this company marketed to the public as opposed to marketing to doctors, where most medical devices marketed to a doctor. The patients now are actually asking for the procedure because they're seeing magazine articles, they're seeing news broadcasts. Laser lipo is surgery. It is a surgery just like a regular liposuction. A laser probe is placed under the skin, heats up the tissue, heating up water and heating up the fat. There are claims that there is skin tightening, although there has never have been histological or microscopic evidence of this. The tightness is a result of the undersurface being basically burned by the laser. After the laser is placed, that same cannula is placed in, just like traditional liposuction, and the fat is simply sucked out. Other laser liposuctions that are on the market are CoolLipo, Pro-lipo, Lipolite, Lipotherme, Slim-lipo, Smoothlipo, Smart Lipo Max, and Smart Lipo triplex. We just went over a lot of material and I hope this helped you. In summary, in the right type of person, a non-surgical result can be very impressive, particularly with Cool Sculpting in my opinion. If you have more specific questions, please write them below. I would gladly go over them. If you haven't subscribed already, please do. Thank you.